Good evening. Welcome to today's topic, which is expanded program in immunization. This is a continuation of the topic that we started last time. And last time we looked at a review of immunology under immunization. So let us continue from where we stopped. So the expanded program on immunization is a World Health Organization program with the goal to make vaccines available to all children throughout the world. The World Health Organization, who initiated the expanded program on immunization EPI in May 1974 with the objective to vaccinate children throughout the world. So this program of expanded program in immunization, which is under WHO, is to ensure that vaccines reaches the whole world so that children they can have access to it. In 1999, the Global Alliance for Vaccines and Immunization (GAV) was created with the sole purpose of improving child health in the poorest countries by extending the reach of the expanded program immunization. So this GAV was created to ensure that children in poor countries they have access to these vaccines. Let us look at the goals of expanded program in immunization. One of the goals is to ensure immunization of children under 1 year of age in every district. So this program ensures that every child who is below the age of 1 year, they get vaccinated. Also, globally eradicate poliomyelitis. The program ensures that there is eradication of poliomyelitis in the whole world. And I'm happy to mention that Zambia is one of the countries where polio has been completely eliminated. The other goal is to reduce maternal and neonatal tetanus to an incident rate of less than 1 case per 1,000 births by 2005, to cut in half the number of measles-related deaths that occurred in 1999. So in 1999, we had a lot of deaths which were related to measles. And because we're talking of vaccines, these vaccines, they prevent children from various infections, and among them is measles. So we are to ensure that these children are prevented from preventable conditions such as measles, so that even the death rate can reduce. Another goal is to extend all new vaccines and preventive health interventions to children in all districts in the world. So the other aim is to ensure that these vaccines which are new on the market, they reach all children in the world so that they are able to prevent them from communicable diseases. Let us look at the immunization guidelines and schedule. Optimal response to a vaccine depends on multiple factors, including the type of vaccines, age of the recipient, and immune status of the recipient. So we're saying for these vaccines to work properly, they depend on a lot of factors such as the type of vaccine that is being given. Also, it depends on the age of the recipient, the person who is receiving the vaccine, as well as the immune system of the person who is receiving the vaccine plays a very important role in as far as efficacy is concerned. Recommendations for the age at which vaccines are administered are influenced by age specifics for diseases. There are other diseases which are quite common in children, like for instance, pneumonia. And it's for these reasons that there are some specific vaccines which have been uh, formulated and given to child-related ages, e.g., uh, PCV vaccine, which we'll later on discuss. Also, age-specific risk for complications, age-specific response to vaccination, and potential interference with the immune system by passively transferred maternal antibodies. So we are saying the maternal bodies that we get from our mothers during intrauterine life also plays a very important role in as far as protection of various infections is concerned. Vaccines are recommended for members of the youngest age group at risk for experiencing the disease for which efficacy and safety have been demonstrated. So efficacy simply means the ability to produce desired results, the ability to produce desired results. So we mean these vaccines which we are discussing today, they've been formulated to be given to a specific age, and it has shown that these children who have received vaccines within this period of age, they've shown good results. They've shown good immune system against various diseases and infections. Let us look at the targets groups of this vaccination. So the vaccination targets children under 5 years. It also targets school-aged children. It also targets pregnant women. It also targets women of childbearing, that is 15 for 49 years. Then special at-risk groups such as the travelers. We've heard most of the times people being given yellow fever vaccine. If you are traveling to an environment, a place, a location where yellow fever is quite common, you'll be advised to be vaccinated against the yellow fever so that you are protected against that disease. So these are some of the target groups which these vaccines are targeted. Let us look at immunization schedule in Zambia. So the immunization schedule in Zambia, we're going to look at the vaccine, the dose, age for vaccination, number of doses, loads or recommended sites, then interval between doses as well as target against that vaccine. So the first one is BCG, which simply means the Bacillus calmette guerin. So the dose of this vaccine is 0.05 ml, and it is given in patients or children who are less than 1 year of age. It is given at birth or at first contact. You can give it at birth. If at birth it wasn't given, you can give this vaccine at the first contact when the child is brought at the postnatal visit. Number of doses is 1. The load is given intradermal in the upper outer aspect of the left lower arm. This vaccine is given to prevent someone from tuberculosis. The second vaccine that we also have to discuss is OPV. It is given 2 to 3 drops. It is given at 6 weeks, 10 weeks, and 14 weeks. Number of doses, someone has to get 4 doses. Then load, it is given orally. Intervals between the doses, it is 4 weeks. The oral polio vaccine is given to prevent someone against polio. So OPV 0 can be given between 0 to 13 days. Then the other the OPV4, the fourth dose, it is given at 9 months. So we are saying the first dose, it is given between 0 to 13 days. Then the second dose can be given after 4 weeks, then another third dose of second dose after 4 weeks, then another dose after 4 weeks. Another vaccine that is supposed to be given to the children is DPT-HAB. DPT-B-HAB. The dose is 0.5 mils. It is given at 6 weeks, 10 weeks, and 14 weeks. Someone has to get 3 doses. The route that it is given, it is intramuscular injection into the thigh, and it has to be given in the intervals of 4 weeks. So this DPT-HAB is given to prevent someone from diphtheria pertussis, hepatitis B, as well as tetanus. Another vaccine is Rota vaccine. The dose is 5 mils. It is given at 6 weeks and 10 weeks. Number of doses, it is 2. The route that is given is oral. Then it is also given in the intervals of 4 weeks in between. So this is given to prevent diarrhea. This is given to prevent diarrhea. The other vaccine that is given is PCV. PCV. So PCV is given at 0.5 mils. Age for vaccination, or the age at which it is given at 6 weeks, 10 weeks, 14 weeks. Number of doses that a patient has to get, it's 3 doses. And the route, it is given intramuscularly in the upper outer quadrant of the right thigh. So we need to be very careful with these vaccines. We need to ask the mothers, and they'll be describing if these children, they have received these vaccines by telling you like, no, my child was given an injection on the thigh, maybe on the left thigh or right thigh. So when it is the right thigh, it means it is the PCV vaccine. As well, it is given in the intervals of 4 weeks. So this is given to prevent someone or to protect someone from pneumococcal diseases, e.g. meningitis, pneumonia, and the bacteremia. The other vaccine is measles vaccine. It is given 0.5 mils as the dose, and it is given at 9 months and 18 months. So someone gets 2 doses. The route is subcutaneous injection in the intervals of 9 months. In the intervals of 9 months, someone is given measles vaccine to protect themselves from measles infection. The other vaccine is TT, tetanus toxoid. The dose is 0.5 mils. Number of doses 5. The route is intramuscular injection into the deltoid muscle of the upper arm. It is given to protect someone from tetanus. Let us look at Bacillus calmette-guerin called BCG. So this is a vaccine which is frozen dried powder, which is reconstituted with stellar diluent before it can be injected. So this comes in powder form, and it has to be diluted with the dilute that it comes with it. So BCG immunization at birth will reduce the sickness and death from tuberculosis. So once we develop the culture, the attitude of giving this BCG at birth when a baby has been born, we reduce chances of these children dying from tuberculosis as well as illnesses. So the storage of BCG is stored and transported between 2 degrees Celsius to 8 degrees Celsius. BCG should never be exposed to sunlight because it gets destroyed. BCG is more heat stable before reconstitution, but less stable after reconstitution. This is the reason as to why when this has been reconstituted, they ensure that within 6 hours the drug has to be used. And in most cases, you find that in various clinics, they've come up with a program. They've chosen a day where they are just dedicated to give BCG vaccination to the children, so that when the vial has been opened, that vial can be used by a lot of children instead um, just wasting the drug. So reconstituted BCG must be discarded after 6 hours. Reconstituted BCG must be discarded after 6 hours. So this BCG vaccine is contraindicated with the impaired immunity, symptomatic HIV infection, as well as non-HIV infection. They reduce the efficacy of this vaccine. So before administration of this BCG vaccine, before administering of this BCG vaccine, you need to check the label that it is the correct vaccine. Check the vaccine vial monitor to ensure that the drug is still potent and it can be used. Check the expiry date of the vaccine and diluent. Then check that it is the right diluent. So, like I said in the beginning, these vaccines, they normally come with the diluent in the bunch. So in most cases, we don't use stellar water for injection, but we use the stellar water for injection, which comes together with those vaccines. As we check the volume of the dilute that you can constitute with the vaccines, they normally give instructions on the ampule of the vaccines as to how much you're supposed to dilute the vaccine. Draw up the dilute into mixing syringe, empty the dilute into the vaccine ampule, mix vaccine and dilute by withdrawing vaccine and dilute slowly into the reconstitution syringe and then injecting it back. So we are saying you need to dilute with a needle and syringe. You do it slowly and do not shake the vaccine, as this may damage it. Some of us who have the habit of shaking the vaccine like this, it is not allowed, because you increase the heat of the vaccine, and you make it to become uh, uh, to become impotent. So we need to dilute this vaccine with a needle and syringe by pushing the syringe with the dilute into the vaccine until the vaccine gets diluted. Let us look at the normal reaction after reconstitution. There should be a flat topped swelling in the skin at the injection site, looking like a mosquito bite with a small pits. So we're saying when someone has received a vaccine, and when this vaccine has worked efficiently, there should be a mark which will look like someone has been bitten by a mosquito. It simply means that the vaccine has worked well. If you don't have that mark, it simply means that the vaccine didn't work well and you need to repeat it. This usually disappears within 30 minutes. After approximately 2 weeks, a red sore develops, which is around 10 millimeters in diameter. So don't be surprised when someone develops a sore after receiving the BCG. It is normal to have those, and it simply means that the vaccine has worked very well. So the sore remains for another 2 weeks and then heals. A small scar about 5 millimeters across remains. This is a sign that the child has been effectively immunized with BCG. So this is what I'm saying. If there is a scar, it simply means that the child has been effectively vaccinated against BCG, that is against tuberculosis. Vaccination for pentavalent, that is the DPT-Hib, DPTB-Hib. So D stands for diphtheria, P stands for pertussis, and T stands for tetanus. So Hep B stands for hepatitis B, then Hib means Haemophilus influenza type B. Haemophilus influenza type B. We need to pay attention to this because there are questions which normally comes and you're expected to answer these questions. The vaccines contains weakened DPT, Hib, and killed pertussis bacteria. It is a liquid vaccine which has to be injected. So the liquid comes in, the vaccine comes in liquid form, and it contains weakened DPD Hib, or in other words, it contains the microorganisms that causes diphtheria and pertussis, which are in form of bacteria, but these bacteria, they've been weakened. So when they have been injected into a child, the child becomes immune against these microorganisms. So the child becomes immune against infection or conditions which are being caused by these microorganisms. So storage of DPT-Hib vaccines. Storage of DPT-Hib vaccines. It should be stored and transported between 2 to 8 degrees Celsius as well. It freezes at temperature below 2 degrees Celsius and gets irreversibly damaged. So it's not supposed to freeze. If it freezes, the vaccine gets damaged. So it is very important that all the times we monitor the temperature at which the vaccine is being kept. Use the shake test to test whether the vaccine has been frozen. So this is the test that ensures you or allows you to know if the vaccine has frozen. So let us look at the administration of DPT-Hib. Check the label that it is the correct vaccine. Check the expiry date for the vaccine. Check to make sure the vaccine has not been frozen. Like I said, it gets damaged. Then check the valve vaccine status, that is vaccine valve monitor. Check the bottle gentry. Using a 0.5 ml, draw a 0.5 ml of the vaccine, then tap the syringe to remove any air in the syringe so that the dose is accurate before removing the needle. So these tactics or these skills are being taught so that we become accurate in administering the vaccine. It is very important that all the vaccines or all the drugs that we have to give to the patients, we need to check them. Expiry date. Check if it is the correct drug. So all these are supposed to be checked before you administer the drugs. The side effects includes fever. Advise the mother that some children may have fever and are irritable after receiving the vaccine. Local soreness. Some children may get red tender lump at the site of the injection that is not serious and needs no treatment. So some of these side effects which may be experienced, we don't need to worry because they are coming as a result of vaccines which have been administered. Let us look at oral polio vaccine, OPV. The vaccine contains a live attenuated weakened virus. It is damaged more easily by heat than other than the other vaccines. So this gets easily damaged with the vaccines. It can be frozen without being damaged. It can be frozen without being damaged. So it is the opposite of what we discussed with the other ones, where the other drugs we say they're not supposed to be frozen because they get damaged. But for polio vaccine, it can be frozen and it cannot be damaged, but heat, it destroys it. The storage of polio vaccine at central level between -15 to -25 degrees Celsius, and this is the reason why it is frozen. It normally gets frozen because of the minus which we are seeing in the degrees Celsius. At health center level between +2 and +8 degrees Celsius, the vaccine can still be kept. Administration of OP vaccine, check the label that it is the correct vaccine, check the expiry date, as well check the vaccine vial monitor to make sure the vaccine has not been exposed to too much heat. Like we said, heat damages the vaccine. Check the number of drops needed for one dose with this vial. You always need to check the number of drops. Like we say, 2 to 3 drops. Let the mother hold the child firmly, sitting up so that he does not aspirate the vaccine. The vaccine is not supposed to be a danger to the child, so the child is supposed to be held by the mother so that you can administer the vaccine without problems. So open the child's mouth by squeezing the mouth gently between your fingers. Let the correct number of drops of vaccine fall from the dropper onto the child's tongue. Make sure that the child swallows the vaccine. So you need to monitor that the child has swallowed the vaccine, because the whole purpose is to ensure that the child has received the oral polio vaccine. If he or she spits it out, give another dose. If the child has diarrhea, give the vaccine anyway, but give an extra dose 4 weeks after you finish the normal course. Do not record the dose given during diarrhea episode. So when the child tries to spit out the vaccine, you can still give so that you are satisfied that the child has taken or has received the vaccine. Then if the child has diarrhea, we're saying you can still give the vaccine thereafter, but this dose is not recorded. Let us look at measles vaccination. Let us look at measles vaccination. So the vaccine is a live attenuated weakened form of the virus that causes measles. It is a freeze-dried and has to be reconstituted before injection. So it also comes in powder form and it has to be diluted before we give. Only use the dilute that comes from the same vaccine manufacturer to reconstitute the vaccine. So like I said, these vaccines, they normally come with their own dilute. You don't need to use other stellar water for injections or normal saline, but they already come together with their dilutes. Maternal antibodies to measles last longer than other antibodies. So immunization against measles is often not effective before the 9 months of age. So this is the reason as to why if you look at the vaccination of measles, it doesn't start at 4 weeks or 6 weeks. It normally starts at 9 months so that it's effectiveness or its efficacy is good. In most developing countries, children are vaccinated against measles at 9 months of age when maternally derived protection declines from maternal antibodies. The antibodies that we acquired from our mothers, they get reduced, and that's when the vaccine is given. However, it is recommended that all children have 2 opportunities for measles immunization to reduce the number of both unvaccinated children and those who are vaccinated but fail respond to the vaccine. So we are saying a child is supposed to receive 2 doses of measles. So these 2 doses are aimed to ensure that all children have access, or all children have been vaccinated against measles. Then, if the first dose did not work properly, we are hoping that the second dose can be effective to the child, and this is the reason why we're giving 2 doses of these vaccines to the child. 2 doses of these vaccines to the child. The second opportunity for measles immunization plays an important role in increasing the proportion of the population with the lifelong protection against measles, as boosting through natural infection gradually disappears. So this is what I earlier on explained. So storage of measles is stored between -15 to -25 as well. At the health center, it can be kept as well at +2 and +8 degrees Celsius. The dilute should not be frozen, but cooled immediately prior to use, so it doesn't neutralize the measles. So the water that we use to dilute it, to reconstitute it, is not supposed to be frozen. Not supposed to be frozen. So when administering this vaccine, we also have to ensure that we check the label that it is the correct drug. Reconstitute the vaccine in the same way we reconstitute the BCG vaccine. That is filling the syringe and then give the vaccine subcutaneously. Inject in the outer part of the child's upper left arm. The side effects from measles vaccination is fever and rash. Tell the mother that the child may have fever for 1 to 3 days, about a week. Then after the vaccination, sometimes there is a mild measles rash. So these things which we are discussing, the side effects, they are to be communicated to the mother so that they are aware that the child is likely to have these side effects. Because if they haven't been communicated, these are instances where these mothers, they feel that their children, they've been witched. Rota vaccine. Children infected with rota viruses during the first 3 months of life are asymptomatic. Those infected for the first time after the age of 3 months are usually asymptomatic. It is a live attenuated rota vaccine. So the rota virus is a live attenuated virus, and it normally manifests after 3 months. After 3 months of birth. So this is in most cases symptomatic to these children. So the vaccine is supposed to be given. The one in use in Zambia is called Lotarix. The one in use in Zambia is called Rotarix. It is given at 1.5 mg. Root, it is given orally. First dose at 6 weeks and second dose is given at 10 weeks. So like we said, an interval of 4 weeks in between. Let us look at the pneumococcal conjugate vaccine, abbreviated as PCV, pneumococcal conjugate vaccine, abbreviated as PCV. The pneumococcal vaccine protects children younger than 2 years old It protects against severe forms of pneumococcal diseases such as meningitis, pneumonia, and bacteremia. So this vaccine is given, or it is very effective in children who are less than 2 years, and it protects them from these severe infections such as pneumonia, meningitis, as well as conditions which are being caused by bacteria such as bronchitis. It will not protect against these conditions if they are caused by agents other than pneumococcus. So in other ways, we are saying only those conditions which are caused by pneumococcal forms of pathogens are the conditions which can be protected against this vaccine once it has been administered. During administration, PCV for infant use are given by intramuscular injection in a dose of